Hello, I'm Dr. Syed Musthafa Ashraf. I'm consultant physician, Department of Medicine at Prathima Hospital, Kacheguda. So today is a very important topic. I would like to, bring to light many of the things of the changing climate scenario. We have been seeing changes in the temperature as we are seeing a transition from a summer season to a rainy season, and we are still in transition. So, what are the challenges? What are the health impacts that one suffers during a climatic change? The first answer would be infections. Infections which can be bacterial, which can be viral, or it can be of a parasitic origin. But to be more specific, as when you imagine of rainy season or transition from summer to a rainy season, there will be climate changes initially. So with the change, climatic change, there tends to be change in the air moisture levels and change in the immunity patterns as well, and few viruses tend to grow more in those particular favorable season. So for these virus, this particular season is very ideal. For suppose the most commonest is the flu illness, the common cold, which is likely to gain and increase in coming days. Second thing would be as when it starts to rain and there tends to be water clogging levels and water becomes stagnant and water somewhere in the surroundings. So there tend to be increase in the mosquito levels, and with the increase in mosquito levels, the breeding of mosquitoes and the incidence of dengue virus over the past decade and more have been very high in our particular state, particular in our city, Hyderabad. So the need to understand of late, we have seen a good transition because due to the pandemic also and the lockdown effect also, there was a drastic decline in the seasonal infections as well, because everyone was observing a very hygienic and a peaceful and a very clean and clean environment, and because of that the incidence of other infections and viral mediated infections drastically came down, and particularly with hand hygiene and all, the common cold also didn't spread much. And the virus is becoming slowly weaker, and there are mutations in the virus, and it is not of that serious. These seasonal infections, they come every year, and with that thing there is hardly any change in the severity and the frequency of the infections. So what we need to understand that as the rainy season comes, as I've discussed, the first thing would be flu infection, the viral infection, the common cold. Second thing would be the dengue fever, the dengue virus. Because of that, there is a severe, illness due to this mosquito bite. Third thing would be infections due to food. Yes, because of these climatic changes and poor maintenance of poor hygiene and cooking standards, despite be it the indoor food which is cooked at your home or you eat somewhere at outside places, there tends to be increase in the bacterial infections due to food related infections. It can be both viral as well as bacterial. So it needs to be kept in mind. For suppose you're going some outside place, or you're on a travel, or you're on an office work, and become hungry, or you tend to eat outside with your family or on a holiday. So these things need to be kept in mind, and what are all the precautions you should be taking. Another important illnesses in coming these seasonal transitions would be the typhoid fever. This is also foodborne infection, and hepatitis A infections, that is one of the most important cause viral infection for hepatitis, which causes jaundice. It is also caused by a viral infection, hepatitis A infection. These are all the things. And so what good steps are we going to take, as we see a climatic change? Initially, I would like to say, because still our government has not issued any clear authority on removal of masks. That's a very good thing, and I appreciate that. Now the thing is, as the climate changes, there is also a rapid spread in common cold infections. So in order to avoid them, at least when you go outside to a crowded place, there you can use your just the daily mask, which would be preventing, keeping you safe from almost 90% of the inhaled viral infections as well as bacterial infections. Second thing would be again the hand hygiene, use of sanitizers, as uh, almost more than 90% people might be totally must be in practice of using hand sanitizer regularly. That's a good sign. And particularly when you go out or go to a new place, then immediately sanitize your hands, so that if you have infection, you don't give it to another one. And if someone has it, by wearing mask and cleaning your hand, you will be stopping the infection, you will be breaking the chain of infections. Second thing would be keeping our surroundings clean. See, the most important breeding place for mosquitoes, because dengue is usually caused by a freshwater mosquito. To clean the water, don't let the water stand anywhere, and garbage dumping is done properly, and proper hygiene is taken care of your home and the surrounding areas. Then yes, definitely, though there is an increase in the mosquito breeding levels. You recently cited an article in the newspaper that alarmed doctors of our city, that rampant dengue infections have been seen. So I would like to quote that. So these important steps, see, you will not be allowing any garbage to pile up. You will not be allowing any water to stand up, and keeping the trees cleaning, and spray of insecticides or pesticides properly surrounding in your surroundings, will almost decrease the chance. Almost, I mean to say, it's more than 90%. You'll be preventing a total occurrence of dengue related or viral related illnesses. And simultaneously, if you are going to other places as well, or if you happen to stay by, or particularly in the afternoon and the night times, so you need to be more cautious of at least using proper skin mosquito repellent, that is cream preparations of mosquito repellents, what you get commercially in the market. Second thing, if children and elderly are there, proper use of mosquito nets are advised by the government of India as well, and WHO as well. So mosquito nets also provide a very good protection, and particularly nowadays, we are getting those insecticide sprayed mosquito nets which are pre-treated. So those are also available commercially in the market. You can use them, and with this thing you will be preventing another disease named malaria as well. Yes. So the good thing is, due to our city being a very urban city, there has been a drastic decline in malaria levels. But still, in surrounding districts and the outskirts and few parts of our city, still observe these kinds of infections, malaria fever. And though it is a very troublesome disease, and it requires almost 2 to 3 weeks for the total eradication of the parasite. So it increases hospital rates as well, and it increases the recovery rate also. It takes so many days of yours, precious days of yours. So with these simple steps, you can almost get rid of these infections, and almost you can hope for a safe climate change in this good and safe rainy season. Thank you so much. With all these piece of advice, I take leave.